Respected Chairman, Christian Group of Institution, Mr. Sunish Jos, Principal Professor Blossom, Christian School and College of Nursing, other dignitaries seated on the dais, dear students, faculty members, parents, and this auspicious gathering. I'm very privileged, really privileged to be here to address you all on this lamp lighting ceremony. As a nurse, when I stand here, I feel it is always great to welcome and also to address to the students who are entering into nursing profession. So you must have heard about when they, reading my resume. I started my profession as a staff nurse. And when I stand here as a nursing professional who is completely into nursing education, I must tell you that I always cherish those moments where I worked as a staff nurse. And when they were giving you the introduction about lamp lighting ceremony and also while giving the welcome speech, they were mentioning about the importance of lamp lighting ceremony. Maybe I think it will be better that I will speak you few words about what is lamp lighting ceremony is all about. So it's your day and you all must have a smile on your face because, in the profession of nursing, when you're studying, actually, you have two important events. One is your lamp lighting ceremony as you enter into your profession. Another one is in your graduation, when you walk out as a trained nurse to practice your profession. These are the two times you take Florence Nightingale's oath. And remember Florence Nightingale oath with a lot of dedication and compassion. So when I speak about lamp lighting ceremony, we do lamp lighting ceremony as a tribute to Florence Nightingale, who is the pioneer of modern nursing. When you look into the history of nursing, actually, I'm not going to speak about the history of nursing. Nursing never had, the so-called professional backup as we have right now. So when Florence Nightingale came into nursing, she was attracted by the need to care for wounded soldiers and she came into this particular profession. So that time the condition of nursing was very pathetic. If you just think about doctors performing surgery and giving medication and patients are abandoned in the hospital, and if care is not given to the patients, how the patients are going to be better. So that was the calling what Florence Nightingale had. Being a very dedicated, well-educated, reputed English woman, she was moved by compassion by seeing the suffering of the people during the Crimean War. So she, along with a small group of committed ladies, she moved forward and she trained them and she went to take care of those people in the Crimean War. So why we call her as Lady with the Lamp? That is very important as you enter into your profession for you to understand. So what we see in the history is that when all the medical officers, they have retired for the day, they finish their day by 8 o'clock and they go back, or by 6 o'clock they go back, and the patients are wounded in pain, and patients after surgery, they were in the barracks or in the military hospitals. So that time we used to see this lady having a small lantern in her hand, and she used to walk at the midnight through the corridor, and every wounded soldiers or the painful people who are in pain, they used to look at her and their face used to really fill with happiness and smile when they see this woman. So you can just have that vision in your mind, this lady going to each patient, standing near her, and then, just looking at them and finding them, how are you, just asking a word. So that was the reason why she is known as Lady with the Lamp. So every day she used to be seen in the dark corridors of those military hospitals, walking with this lantern. So I wish that all of you will have that love and that compassion in your mind when you hold these lamps in your hand and take the oath of Florence Nightingale. So you know that, what is the meaning of lamp lighting is all about. Nowadays, when we think about nursing, it's not like the olden days when we practice nursing. People had lot of compassion and people had lot of commitment towards taking care of the people. So we go to hospital and our chairman, usually Dr. Santosh Koshi, when he come and address Like, as a practicing physician, he keeps saying that nurses don't have the commitment. So I want to tell you there are 3 C's, which is very important, and that you have to remember from today's speech. 1 C stands for compassion, 2nd C stands for commitment, and 3rd C stands for competence. Okay, so if a nurse, if you have to stand aloud and say, I am a professional nurse, you must remember these 3 C's in your mind. You must have compassion. What is compassion? You see, compassion, when I say, when you have a desire to alleviate the suffering of the people, you can call it as compassion. Otherwise, you cannot give the name as compassion. So you should have that feeling within yourself. When you see somebody in pain, you should automatically have that compassion within your mind, that can I do something for a person who is suffering? That is the core essence of nursing. Second one is you should have competence. Competence, when I say competence can come only with what? Competence can come only with knowledge. That knowledge, if you acquire knowledge, then only you can have competence. We always say competence in terms of attitude, competence in terms of knowledge, competence in terms of skill. So you are given with an enriched curriculum actually. Starting from your first year, you learn anatomy, you learn physiology, you learn microbiology, you learn pathology. You know it, right? And sociology. And, I will tell you, there is no other subject which you learn, which teach you how a human being is completely formed. That means why you do all that? Because ultimately you understand a human. You know the psychology. You know how the society is formed. And you know family is important for a patient. And you know how family is suffering when a person is sick. So you are able to give compassionate, competent, holistic care to the clients who are coming. So I want to give you one more thought before I end up. I don't want to prolong my talk. So remember always, many nurses now come, when they are asked to push a trolley, when they are asked to do something in an emergency for a patient. I'm just telling you completely in a scenario where you're working in a hospital. So you have a lot of challenges in front of you. You say, this is not my work. Pushing a trolley is not my work. Cleaning a patient is not my work. So where do we stand? I must tell you, in any profession when you take, for example, you think of a hotel management person who work in a 5-star hotel. If suddenly something spill on their dress, how they go and clean it. Madam, can I help you? Can I clean it? And also you're flying or you're traveling in a flight. Something happens to you. How the air hostess will come and approach you. And I believe that, if all the nurses or all the nursing student has that kind of a professional approach to the service what you are giving to the humanity or to the patients, you can make a lot of change. So individual nurses, I must tell you, when you stand wearing a uniform in your hospital or in your healthcare settings, wherever you are, always remember that you stand as, remembering the commitment what Florence Nightingale had towards the profession. So I have already told you what is care and what is competence, and third one is commitment. Commitment, when you speak, it is, 2 important terms are there in commitment. One is responsibility, another one is accountability. Okay, so if commitment, it becomes rich only when it is coupled with accountability and responsibility. So if you are taking care of the patient, remember what commitment you have towards that patient, because that patient is the important member of a family. So I request you all never to take this profession very light, and similarly I request all the faculty members, principal and the management, when you train nursing students, medical students or any other healthcare professional, remember they are standing in the community to take care of people who are in need, and they have to be taken it very seriously, because otherwise the life of the people are going to be at stake. And Florence Nightingale had given you a very good vision about nursing. So as you enter into nursing profession, You are taking the oath of Florence Nightingale. And I request all of you, please try and understand what is the meaning of each words and each lines of Florence Nightingale's oath. And this only in nursing profession we follow lamp lighting. So it has a lot of significance. Please remember, nursing, you're committing your life to the profession of nursing. And nursing, again, it is just not giving care to the patient. Nowadays, nursing has gone to different horizons itself. Like we have started, Indian Nursing Council has started nurse practitioner course. So you know that you can practice independently at different hospital settings. And even at the health sector, you have community health officer post, where after your BSc Nursing, you can work as a community health officer. So there are different posts coming up. Nurse practitioners in each specialty, you have MSc Nursing. And then even after your BSc Nursing, if you want to go for healthcare administration, you can work as nurse administrators. We have CEOs, nurse CEOs in hospital setting. For example, MIMS you take. So I must tell you, students, that you have to take your education very seriously, and you should not be ignoring your curriculum, and take it as a calling for your life. And then later on, after your 4 years, you can decide which line you have to choose. So I really congratulate all of you for taking this noble profession, and I congratulate the teachers for training you to have this particular function, including your principal and management, in such a disciplined way, because I go as chief guest for many colleges, and then this I find it in a very disciplined way. I congratulate the principal and the teachers who have worked behind it. So as I close my speech, there are some beautiful lines. I always when I take my first class for my first year BSc or wherever I speak, I always read it for the students who stand with this lamp in their hands, because this is written by Florence Nightingale and it is taken from the biography of Florence Nightingale. Okay, so it goes like this. The lamps you hold by hand today affirm your wish to toil always, relieving pain and suffering of sick, deceased brethren all day. Like lady with the lamp you show, your heart has love and compassion for mankind, sick and afflicted. To God the healer you thus bow. The lamps will show the world around that nurses are a noble lot, who sacrifice their life and time to make everybody's health sound. So this is what nursing is all about. So I would like to say that nursing is completely a calling. You cannot compare this with any profession, arts or any course what you are doing. If you don't realize that calling what is within you, I must tell you that you will not be able to prove yourself as a meaningful nurse. So my sincere prayer and wish for all of you sitting here is that you will really understand and realize the calling within yourself, and you will dedicate your life, and then you will be dedicating your life into the service of humanity. God bless all of you. Thank you.